My name is Devin Loney. I am an audio engineer who works on the support team at SHOEBOX. In February 2019, I visited the Democratic Republic of the Congo to work with the Union, a global scientific organization whose mission is to improve healthcare among people living in poverty. I headed into Kinshasa, the capital and largest city in the DRC, located on the Congo River. Here, the Union is focused on the treatment of multi-drug resistant tuberculosis. The Democratic Republic of the Congo is the second largest country in Africa. Roughly the size of Europe, with a population of 80 million, the DRC is heavily burdened by MDR-TB. Since gaining independence from the atrocities in their Belgian colonization during the 1960s, the Congolese have endured over 3 decades of armed conflict and have lost over 5.4 million people due to war-related causes, making it the deadliest conflict since World War II. Their economy, infrastructure, and healthcare continues to struggle as the country attempts to rebuild. The people of the DRC represent over 200 ethnic groups, with nearly 250 languages and dialects spoken throughout the country. Kinshasa, the capital, is the largest French-speaking city in the world. MDR-TB is a treatable condition. However, the drugs are ototoxic, meaning they are toxic to the ear. The most common drug regimens can cause permanent hearing loss. This is where SHOEBOX comes in. The Union held a week-long conference on MDR-TB in Kinshasa. They purchased 30 SHOEBOX audiometry systems so that they can test the hearing of MDR-TB patients when they come to the hospitals for treatment. If hearing loss is detected, and often it presents itself at the highest frequencies before the patient even realizes there is a problem, then the course of action treatment can be altered to help combat the potential side effect of hearing loss. We were invited to help them set up the systems and train them on how to use SHOEBOX. The lead doctors from each province flew into Kinshasa for the conference that centered around testing with SHOEBOX, early onset ototoxicity detection, and otoscopy in the field. This conference represented a major development in healthcare for the Congolese doctors. The energy was buzzing all week. The amount of positivity and excitement for SHOEBOX was way beyond my expectations. The doctors were most welcoming, highly educated, and extremely proud of their work. Their passion for rebuilding their country through improving healthcare conveyed a true pulse for humanity, a feeling that is hard to describe in words. This energy was contagious, and it carried me through the week. 2 days were spent teaching SHOEBOX to the participants, while the 3rd and 4th days were spent working with MDR-TB patients in the field. The patients were able to learn how to use SHOEBOX to self-administer a hearing test in seconds. The doctors were beaming as they told me they had never before imagined that they'd be able to test this amount of patients in a single day. With recent political changes, the doctors also told me that these patients would get free healthcare. A new coverage program was recently released which added to their excitement. Meet Nadila. She is 8 years old and from the neighboring Congo, Brazzaville. The youngest in her family, she took on the responsibility of caring for her ailing grandmother so that her brothers and sister could continue to go to school. Nadila unfortunately contracted TB from her grandmother in the process. By using SHOEBOX, the doctors were able to detect early onset high-frequency hearing loss and adjust her medication regimen the very same day, preventing her from permanent health impacts. SHOEBOX represents a paradigm shift in MDR-TB care for the Congo. By being able to test patients quickly and accurately, the MDR-TB hospital no longer has to arrange transportation through special quarantine ambulances to the traditional audiological center across town. This frees up the resources for more patient intake and cuts their treatment time significantly. The Union doctors estimate that they will be able to reduce MDR-TB treatment times from 24 to 9 months, while increasing their success rates above 85% from below 50. SHOEBOX is not only helping prevent hearing loss through early detection, but we are also helping to make a positive impact on humanity by improving the quality of life of children like Nadalia and helping to save lives by opening up bottlenecks in current TB treatment systems. We believe everyone deserves access to hearing healthcare and are proud to be the leading evolution of hearing testing solutions.